Aye.
Hi, good afternoon. Christine Carlson. I'm coming before you again. I have learned from the Board of Directors Liaison at Lifeways that there is still a position. Oh, I'm sorry. Better now? Still a position opening on the Board of Directors for Lifeways. So I'm here to throw my hat back in that ring today. And just a little bit more, I had given you my resume before. I know that I'm a parent of a special needs child adult here in Jackson. I'm working a lot with some adult programming. I'm retired right now, so I'm able to give my full attention. I know that there was a position available to the for the Board of Commissioners to join, and if I could be that person, I would love to be able to report back to you monthly or whatever needed and be your liaison between the Board of Directors and yourselves. So I'm just here to put my application back in for that seat that's available. Christine Carlson.
Good afternoon. My name is Melissa Callis, and I'm the board chair for the Lifeways Community Mental Health, and I'm just here to provide support for Christine Carlson as she makes her notice known that she is available to become a board member if she is appointed. So, thank you.
Good afternoon, Jeff Peterson. I'm the Vice Chair of Lifeways, and I'm also here to provide support to Mrs. Carlson in her endeavor to be appointed to the Board of Lifeways in the event that there is an opening. I know that she's a parent of a developmentally disabled daughter, and she, as she stated, she's retired and volunteers around the community. The reason for her retirement, I believe, was so that she could provide more services and help provide more services to the population here in Jackson County. So once again, throw my support to her if there is a possible opening. Thank you for your time. Support. Aye.
Good afternoon. My name is Shannon Clevenger. I'm here to represent Lifeways. In your packet, you received a report from Mary Beth, and I'm just going to provide you with some overview of some of the topics. First one's related to strategic plan, our update on better health. We're moving into year 3 of our grant for an integrated care model. We've completed site visits at Kalamazoo Community Mental Health and Substance Abuse Services and Saginaw County CMH Authority. Both of those CMHs have embedded primary care into their system, and so we wanted to see kind of how they had done that physically from a physical plant perspective. We have a post-hospital review team that's been established to focus on high emergency department utilizers to reduce inpatient recidivism. And we are submitting a concept paper to apply for the Michigan Health Endowment Fund to provide integrated health services with a focus on Hillsdale County. For better care, through a millage proposal, we sent out proposals for social recreational services for intellectually and developmentally disabled individuals as part of Jackson County's millage. We are happy to let you know that a new provider was selected and has begun their first year programming. The program is called Club Life. It started on April 1st. They have a Facebook page, a website with a calendar of events that they're providing for social, leisure, recreational opportunities for individuals in Jackson County. Our millage implementation began January 1st. Mary Beth will be coming, I believe, next month to provide you with an update on that spending. We have a 45-day claim window, so the first quarter ended March 31st, and they would have 45 days to get claims in. So she's hoping that will be a cleaner report for you in May. We have a new provider, Southeastern Dispute Resolution Services, that has been selected for independent facilitation for individuals receiving CMH services. Our Stepping Up initiative for data collection, we've had 378 screenings, 26% reported as severely mentally ill at the time of booking, 52% recidivism, and 40% report drug use. Our next steps with this is we're going to be providing law enforcement training. For better experience, strategies for recruitment and retention of staff, an onboarding process, and we do have the JobStar resource available to our employees. And for lower cost, Lifeways has implemented our key performance indicators with quarterly monitoring. We have a residential action team, which has been focused on out-of-county placements. We have individuals that were unable to be placed here locally in licensed group homes who've been placed out of county. And this team is working on bringing those individuals back into our county. Our initial projections, if the level of care of the individual's needs stay consistent between their out-of-county placement and their in-county placement, it is projected to be a $1 million reduction of out-of-county placement costs. We are now participating in a Mental Health Minute. Lifeways will, as part of our marketing plan, be doing a series of short clips to raise awareness about Lifeways, mental health, and our services called Mental Health Minute. In your package, she provided you with a link that you would be able to click and go in and look at those. With relationship to Midstate, our PIHP, we were notified that our region achieved all 3 of our following performance incentives for the region as a whole: partnering with health plans, increasing participation in patient-centered medical homes, including uses of electronic sources to monitor populations and coordination of care, and support of the Veteran and Military Member Strategic Plan. Based upon that, Lifeways will be receiving $553,760 as local funding of those incentive payments. And that concludes my overview. Yes.
How you doing?
I'm good. How are you?
Good to see you. I just have 2 quick questions. First question, that training that you guys are providing, is that training also being provided to any of the staff over at the youth center?
For the law enforcement training?
Yes, ma'am.
It's in development right now.
Okay.
So let me make a note. I brought a pen to make sure that they are included.
All right, thank you.
Yep.
I think that would be helpful for their
Okay.
staff as well. And then an additional question would be, could you just provide us a update on the building project at the main office and how that's going and the progress of that
Yep.
project?
So we received a $6.2 million bond to renovate the building up here in Jackson, and we are currently working with the architectural firm to develop phases. There's going to be about 3 phases of the building remodel, and this is to support our integrated care model and also to provide us space for a 24/7 access center. So currently our access runs 8 to 7. And then we present at the emergency department for individuals in crisis. Our plan is to have a continuum of care of crisis services, 24 hours a day, 7 days a week, which could be walk-ins, also having our crisis R&R in place, crisis residential, and crisis support services. So the project is currently with the architect, and we're meeting about weekly to work with the architect to work on the phases, because staff are going to have to physically move throughout the building as the remodel happens, but we are responsible for client care. So trying to figure out which phase is the most critical to get done first, but least impact of client care. So I think they talked about summer, hopefully, to be able to have the project started. Oh. Okay. I will follow up with ours.
I don't know whether to direct this question to you or to you and Deb, but would it be possible for, I mean, I have it, so I know kind of a gist of it, but a breakdown of the requirements for board members on Lifeway, so that way all the commissioners can have a clear understanding of what the different roles on the board are.
primary consumer, secondary consumer.
The commissioner seats in a specific person. So I have it.
I get it. Yep.
Lifeways forwarded it to us back in January when they knew that our seats were rotating. The seat you're referring to, though, is a default seat that belongs to two county commissioners for Jackson, just like there's two county commissioners for the paying body from Hillsdale. We can choose to subordinate that seat if we so do, and have in the past, and had either past commissioners serve or concerned citizens. Also, so it's an open seat, but the Board of Commissioners has first shot at it. And then if the seat is chosen to be a non-county commissioner, then it defaults to the full criteria you're referring to of being a secondary or a primary consumer, or any of the associative organizations that are required by the Lifeways organization. And you're also asked to take a survey to join Lifeways, so they know what education you need for orientation purposes. Is what they do offer also, and I know that Mary Beth had sent that, and it is in Delane's file.
Thank you so much. Sure.
Mr. Chair, before she starts, I'm going to request of Deborah that you make sure that medical care is here next month, so the commissioners can understand where we're at and we can review their budget. Please?
Good afternoon, and thanks for inviting me here today. My name's Julie Weatherby, and I'm the CEO at the Region 2 Area Agency on Aging. And we provide services to older adults in our community and adults with disabilities so that they can remain in their home and independent in the community. We also provide other programs and services to foster this independence in the community. Some of our programs have income guidelines and others don't. But we also have many programs that do not have any income guidelines. We're local experts on aging and disability resources, so we always like to say, if you don't know who to call us, and then we'll direct you in the right path to get the help you need. You should have a report that was sent to you all a bit ago. This is the report for the first quarter of fiscal year 19. So you can see the funding for the different services that is going to Jackson County. We also have, just as a reminder, we serve folks in Jackson, Hillsdale, and Lenawee counties, so some of our funding covers all three counties, and that's legal services, which covers all three counties. We've served 632 My Choice Waiver clients in in Jackson County this year so far. As of December 31st, 84 care management clients, and then we also help to transition people home from the nursing homes. Information and referral calls, we received just over 900 calls from Jackson County residents, and many of those referrals are made from those callers to Jackson County agencies, and that was about 168 calls. We also partner with the Jackson Care Hub, and we've performed, as of this report, 13 screenings for the Jackson Care Hub, and we received 14 referrals, and we served 11 clients through the Jackson Care Hub. We also helped just over 1,300 clients with our Medicare Medicaid Assistance Program, and that's a program where we offer advice on Part D plans for those in Medicare, and it's unbiased advice, as we're not aligned with any insurance company. So we do a total person-centered plan with folks on what their choices are for their Part D Medicare plan and help them through that process. We also help folks that are new to Medicare. So far, our funding is on track for the fiscal year 19 spending. We're also working on advocacy. We're developing an advocacy plan for the agency. It was presented to the Advisory Council and the Board of Directors last month, and then we're bringing a formal plan to the Advisory Council and Board of Directors this month. We're working with the National Area Agency on Aging Association to advocate for policies benefiting older adults, including reauthorization of the Older Americans Act, social determinants of health, and expanding aging at home and in the community programming. And we're also working with the Silver Key Coalition to educate legislators on the My Choice Waiver Program. Currently, through the budget that's been recommended, there's about an $8.3 million cut proposed by the governor for the My Choice Waiver Program. That's our biggest program that we help people stay in the homes as opposed to being in a nursing facility. So we are busy educating legislators around the benefits of that program and to hopefully do away with that funding cut. This year, we are working on a multi-year plan preparation. Just as a reminder, every 3 years, we have to put out a new multi-year plan that kind of states our goals and activities as an area agency on aging. This is required due to our funding from the Older Americans Act, and it's required at the state level. We have to present the plan to the state in August or September, depending on the date they give us. So we're having different focus group meetings around the 3 counties, and there's going to be one on June 18th, on June 18th is when the multi-year plan will be brought to this commission. But I'm trying to find it here. Yes, Nicole, April 24th is the date we're going to have a focus group meeting at Jackson County Department on Aging for their advisory council.
Is that April 21st?
24th. At what time? 1 o'clock. 1 o'clock, okay. So we're in the process right now, and I think we forwarded it here for your attention too. As part of the area plan, we do surveys around the 3-county area to get the needs of the people we serve. So we forwarded the survey here, so I'm hoping that you will all complete the survey so that we can take into account your recommendations on what you're hearing from your constituents. The RFP will be made available to the public by the end of May, and then bids are due back to the agency by July 1st. And then I already talked about the focus group on April 24th during the Jackson Advisory Council meeting at the Jackson Department on Aging at 1 o'clock. Upcoming events we have this year are we're having an anniversary open house on May 2nd from 11 to 1 at our offices. This is our 45th year anniversary, so it's a big year. So I invite you all to stop out to our office in Brooklyn. We're right on Main Street, 102 North Main, and we're having an open house and some light refreshments between 11 and 1. We'll be sending an invitation out too for disbursement. Older Michiganians Day is happening on May 15th up at the Capitol. This is a day where many seniors and senior advocates gather on the lawn of the Capitol, and we talk about issues affecting seniors, and we invite you all, of course, to come to that as well. And then per our bylaws, we have an annual meeting every year in May, and this year it's on May 23rd at 2:00 p.m. in the afternoon at our office, and that's where we, our board announces their officers for the next year, and we talk about what's happening in the network and what's happening at Region 2 Area Agency on Aging. Also on June 11th from 5:30 to 7:30 p.m., we're having our Safe Haven event. It's a fundraising event at the Point on Clark Lake. Safe Haven, as a reminder, is a program that we've established. It's something that we developed at Region 2, and we work with Adult Protective Services and provide a safe place for folks to land that are victims of elder abuse. So there's quite a need in our three-county area, especially Jackson County. So far this year, we've had around 25 referrals for people from Adult Protective Services, and last year, our total client list served was around 18. So we're noticing a lot of homelessness in the three counties, especially Jackson County, and other things are happening so that we're trying to prevent this elder abuse situation. So anyway, this year we were lucky enough to get a grant from the state of Michigan called Prevent for prevention of elder abuse, and we also got a grant from the Victims of Crime Act to keep this work going. We got a national award for the work last year at the National Area Agency on Aging Association Conference. So it is important work that's being recognized around. The reason we need to have a fundraising event is because we can't cover all the costs, especially the temporary housing costs that are needed to put folks in a safe place while we help them, guide them through whatever their situation is. So those are the updates I have for today. Any questions? Yes, I will. Yeah, we'll get invitations out.
Any other questions, commissioners? Okay, thank you very much.
Thank you.
Health Department.
Good afternoon to all. I have a few highlights, I think, to add to my report that's in board docs for you. I think you're probably all pretty much familiar with where the health officer recruitment effort is at. The in-person interview was complete on March 20th. The candidate has accepted the position. I believe that they have been approved by MDHHS, and that you would be processing a resolution next Tuesday at your board meeting. Does that match up with what you know, Deb? Okay, that's the information I have. We offer, of course, every time there is an opportunity for new members to come to the county commission, we offer an orientation at the health department to our mission and our programs and services. And we did offer that on March 18th, and we're glad that Commissioner Williams was able to participate with us, so thank you very much. March 25th through the 29th was Severe Weather Awareness Week in the community, and we were involved in that in promoting community emergency preparedness. We have a flyer that's in board docs for your information. It's called Keep Your Family Safe, with a 72-hour home emergency supply kit. That's the flyer that we included. And it was prepared by our emergency preparedness coordinator at the health department. It's actually been pretty widely distributed in the community through social media and 211 email blasts. And it's also posted in many hardware and home improvement stores in the community. So we're trying to help people understand what's an emergency kit consists of, what should be supplied in it, and that the home improvement stores and hardware stores are helping us even more. If you've gone into a store recently, they actually have the flyer posted, and maybe next to it they have another poster that indicates you can go down these aisles to get these items. So it's a very nice partnership that we participate in with them. You might wonder, where is this coming from in terms of the flyer? Well, the need to emphasize individual and family preparedness was recognized through analysis of data from the most recent community citizen survey that the county fields every couple years, and a well-being survey that we do through the Health Improvement Organization and other collaborative networks in the community that were completed over the past 2 years. So we're actively trying to use the data that we generate through the questions that we include in the National Citizen Survey. A quick update for you on the Hearing and Vision program. We have been working for some time and trying to deal with an access to care issue involving families who have children who are enrolled in Medicaid that we screen through the school districts. We screen about 17,000 kids a year, and roughly about 2,000 of them are identified as potentially having a vision abnormality. and then we communicate with parents by letter and also by text message, informing them that their child may need further evaluation. And then we're hoping that what happens is that families will contact an ophthalmologist or an optometrist to get their child evaluated. Some do not do that, but overwhelmingly, what we hear from families who are on Medicaid when they try to access an optometrist is they have a lot of difficulty getting in. There aren't that many slots available for them in the community, and some optometrists won't take Medicaid at all. It's predominantly a low reimbursement rate problem that our optometrists face, and it's not unique to that particular discipline or specialty in the community either. But this is one that we've uncovered, and we're trying to work on this with Representative Alexander as well. I referenced an attachment in my report. I noticed that this morning I failed to get that attachment in there, but it doesn't really matter too much because the bottom line is looking at the numbers for Jackson County, the percentage of referrals that we've made to families in hopes that they will connect with an optometrist, only about 10% of them are actually paid claims for the age group 0 to 3, and for the age group 6 through 14, about 16%. So we think we have a real access problem that we're trying to work through here in the community and see what can be done about it. As one potential step moving in that direction, I met with our Hearing and Vision Program Coordinator and with Molly Kaiser and Sarah Benedetto, Chief Operating Officer at the Center for Family Health. As you know, the center has been very helpful in our community in increasing access to care. They have done so both with their physical presence here for physical health, but also with dental health care as well. And they might be an option for establishing a vision clinic in the community that could get a higher reimbursement rate for seeing Medicaid children and maybe get us at least a part of the way towards solving this problem in the community. We do see children from not necessarily grade to grade, but every other grade. We have seen the same number of children or some of the same children who have failed their vision screening again, and they're not getting followed up on. So this is a real problem for us in terms of children learning. They can't learn well in school system if they can't see and they can't hear. So we're following up on it. I also shared a WIC update. Our 2018 WIC food costs per county in Michigan were released, and we were pleased to be able to report to you that the combined amount of WIC money or EBT benefits, if you will, that were spent by clients at all the food vendors in Jackson County exceeded $2.5 million in 2018. So we're really grateful for the resources that support good public health nutrition and help a lot of local grocery stores, big and small, stay in business. And it's all because of the work that our WIC staff do every day that makes it happen. I included an update in here about Ebola in the Democratic Republic of the Congo. You may remember a few years ago we had a very active screening and monitoring program in place. Every health department in the nation, if you will, was screening under CDC and MDHHS guidelines. Well, we have not gone exactly in that same complete direction this time around. As of March 11th of this year, there were 1,095 cases reported in the Democratic Republic of the Congo, and it included 584 deaths, so that's a close to 50% mortality rate in that country. But there are multiple differences between the 13-16 West African Ebola outbreak and the current situation. Right now, there's no centrally coordinated identification and screening of travelers returning from DRC, as there was back in 13-16. The current CDC recommendation for travelers from the outbreak is self-monitoring during travel and for 21 days after leaving the area. Travelers are being advised to call ahead before presenting to a doctor's office. And CDC is making specific recommendations for organizations that are sending workers to the outbreak area. MDHHS and the Special Pathogens Response Network here in the state, if you will, continue to recommend screening all patients for travel history. I know that they are continuing to do that here in Jackson County through Henry Ford Legion's health practices. So we'll be keeping an eye on that.
Question. Isn't this current strain of Ebola much more virulent than the one that we had about 7-8 years ago?
It's possible, yeah. I don't know for sure Dr. Tompkins, if it's exactly the same strain as the 1316?
It isn't,
Okay,
but it's supposed to be more virulent and more deadly.
sounds like it probably is.
Thank you.
You're welcome. You heard Julie make some comments about the Jackson Care Hub. We also have some, I'm sorry. Yeah. Okay. Well, the decision to do travel monitoring isn't ours necessarily locally here, and we don't have any way of identifying, let's make the assumption that these are mostly American citizens we're talking about that may be over providing aid and charitable care to people in the Democratic Republic of Congo, so they're returning to the U.S. It's not necessarily that people from the Democratic Republic of Congo are coming here to the U.S. When the last time we did this effort back in 1316, it was monitoring American citizens coming back from the Congo. So we're still talking about those same people being monitored with a travel history. But we're not doing anything locally here at our health department. Yeah. Sure. Well, in the last travel monitoring that took place, people weren't actually quarantined either. They were allowed to come back, they were in their homes, they were monitored on a frequent basis, and we didn't have any adverse outcomes occur as a result of that travel monitoring effort. The mortality rate in this particular episode, or this outbreak occurring in the Democratic Republic of the Congo, is actually a little bit higher than it was previously, in the previous outbreak. So I get your point, but we don't have any way of monitoring people coming back from the Democratic People's Republic of Congo unless we're told who they are. And right now, that information is not being released to us. So, I appreciate your point. Only if it's given to us through the State Department and CDC. That's where it's being tracked. Yep. As I was saying on the Jackson Care Hub client feedback, it is doing good things for our community. One of our nurses recently shared the feedback she received from a health department client. She reported that she was here for treatment and told that her social determinants of health screening was really successful. That's what she told our nurse. She was able to get into the Center for Family Health, was assisted with applying for Medicaid, scheduling an appointment with the PCP there, and getting her first ever pap smear. So she was very complimentary to our nurse for the assistance that she got from the hub. She also got 2 vaccinations and expedited partner therapy for her partner through the sexual health clinic. So it really is, I think, the Care Hub is improving individual and community health through active referrals to organizations and agencies who can provide the needed assistance. So it is a big bonus for our community. We did have one potential measles case reported to us in a Jackson County resident in the past month. But the results that came back were negative for measles, and the case has been closed. We have no other known potential measles cases reported to us at this point in time. There are now 39 cases in southeast Michigan. 38 38 of those are in Oakland County. 1 is in Wayne County. So the threat is still there. This will go on probably for whatever the incubation period is for measles, and we get no new additional cases from the people that have been exposed in that location in the state.
Excuse me, I'm
yes.
sorry. Do you by chance know what county that has this issue that's the closest to us, what that is?
Well, I suppose Wayne and Oakland are right
Wayne
north
and
and south of each other, and that's where the cases have occurred.
Both of those?
Yes.
Okay, thank you.
All cases have been in Wayne and Oakland County. None in Washtenaw so far.
Oh, okay, I thought I had heard of something in Monroe County, but I guess or in the Monroe area anyway, so I guess I was mistaken. Macomb, that's maybe
Yeah.
what it is. I got my M's mixed up.
I think you're right. There is a case, I think, being investigated in Macomb County.
Macomb County, that's
Right.
what it is. Okay, thank you. Sorry about the confusion.
A quick update for you on the Fisher Trailer Park. This is located in Napoleon Township. I did attach a copy of the minutes from the March 13th meeting, which Don Haydock prepared, along with the list of tasks, if you will, that we kind of assigned out to ourselves to follow up on. What I can indicate to you at this point in time, we have only one resident remaining in the park who is, we're still working with to find alternate housing. And one resident that's in the park today is expected to be moved out by Wednesday of this week. So when we're able to successfully relocate people, additional actions will be taken to close down the park permanently. That may include a court order seeking authority for Consumers Energy to disconnect the utilities, and also then placement of concrete barriers to keep people from driving into the park that shouldn't be in the park in the first place. We've still, at this point in time, not heard anything from the park owner, if you will, which is based in Canada. Don has been monitoring this very closely. He has all the updated information in case any of you have any other questions. He's here this morning at the meeting. We do have a number of self-assessments that take place for a number of the programs that the state requires us to provide to our community. One of those is the Private and Type 3 Public Water Supply Program. The annual self-assessment was completed for fiscal year 2018, and we had 100% compliance with all the minimum program requirements for that program. And big kudos to Jason Bivens, our coordinator for that program. He's done a fantastic job with it. Also, we had an on-site annual evaluation of the non-community public water supply program, which Mary Farmer oversees, and she did a great job as well. It was conducted at the health department by staff from MDEQ, and we do also meet all the minimum program requirements for that particular program. So we continue to have really good results with our self-assessments and our on-site evaluations. And that's pretty much everything I have for you today. I'm happy to answer any other questions you may have. You're welcome.
Just very briefly, I just wanted to encourage our new county commissioners and current county, or all county commissioners really, if you haven't had a chance to do an orientation, or if it's been a while in doing an orientation with the health department, I would highly recommend it. I had a wonderful time and learned a lot in my orientation, and so I would want to make sure that all of our commissioners have all of the up-to-date information on just kind of the knowings of what's going on over there at the health department as well.
I'm sorry, I think I missed the question. Oh, yeah, sure, just call my office. Sure.